More than 5 million adults in this country are living with atrial fibrillation, also known as AFib. The condition forces the upper chambers of the heart to beat irregularly and extremely fast, about 500 to 600 beats a minute.
The history that the patient provides is extremely insightful. When you listen to the patient, it's more powerful in terms of telling you what the diagnosis is than doing an ultrasound or doing other invasive or non-invasive studies. There's certain features of these arrhythmias. For example, if a patient is telling me, when I cough, it breaks, and I know in my mind, this is what the circuit's going to be. So then when we go into the procedure and we see this is exactly that circuit, and we fix it, we can tell the patient and their family afterwards, it was exactly what we predicted, and it worked out.
What does the future hold? Dr. Razavi says the biggest challenges with AFib are permanent or persistent atrial fibrillations.
That's our white whale, if you will, of trying to get the most challenging of the arrhythmias. The other thing is fixing ventricular arrhythmias and ultimately figuring out a way to treat patients without causing undue collateral damage. And by that, what do I mean? For example, cardiac defibrillators, we're all familiar. When someone has cardiac arrest, they shock them. They shock the patient. And if you've seen it on TV, it's the same thing in real life, unfortunately. Folks, when you shock someone, they jump off the table. It's painful. So one of the things that we are now trying to do in terms of the advancements, it's not just ablating and fixing these patients, but it's actually trying to mitigate that collateral damage of having a shock that suddenly comes out of the blue.
What THI is focusing on now in Dr. Razavi's lab is to try to make those shocks not even noticeable, painless.
If it's imperceptible, they don't even know it. And the heart goes into arrest, they may feel a little faint, and suddenly they're like, okay, I feel better. That's our goal, and I think that that's something that we will achieve in the next few years.